and welcome to my video on open pores, causes and treatments. My name is Hannah McAndrew. I'm a skin specialist based down in South Wales, also an online educator for new skin technology. However, today's video is going to be generic and not linked to any skincare brand as such. I'm going to try and be as neutral as possible because we are on YouTube and I'm aware that I have this growing audience of students and clients alike. So, open pores. First of all, what is a pore? So all over the body we have sweat pores, also on the face as well. However, when we think of pores on the face, we're talking about the pores that are linked to a hair root unit, and also that will have a sebaceous gland attached to it which pumps oil into the hair follicle. So when we're talking about the face, we're talking about open follicles rather than open pores as such. So you'll literally have these kind of dips in the epidermis, which is the follicle. They contain a hair, so every single hair will have a follicle, and that will have a sebaceous gland attached to it which produces oil. So before I talk about how we would treat somebody who has quite large pores, we need to know the causes. There may be more than one in your skin, in which case we could treat it in multiple ways. So the first thing I want to talk about is the oily skin. So some people's sebaceous glands, due to hormonal activity or genetics, will just produce a lot more oil. They'll be pumping a lot more oil into that follicle, and therefore then, because the follicle contains more contents, it appears bigger. This is particularly true in acne-prone skins, and acne-prone skins also have a backlog of dead skin. So in the follicle, remember, is just a dip in the epidermis, so the epidermis should be naturally exfoliating itself every 28 to 30 days. In your acne-prone skin, there's lots of faults happening in that process and the dead skin gets stuck together, and what you find then is the pore will actually get clogged, and we call this a blackhead. So I'm going to pop a picture of a blackhead across the screen now. So this isn't necessarily an open pore, it's a pore that is filled with a mixture of sebum or oil and your dead skin cells. Now, please don't confuse these with something called sebaceous filaments. Sebaceous filaments are more grey in appearance and they are actually supposed to be there. They are helping your follicles to get rid of the oil, or almost like a passage. They make a passage for the oil to come out onto the surface of the skin. So sebaceous filaments are actually supposed to be there, and if you choose to remove them by squeezing like you would a blackhead, then they will just come back. Every 30 days or so, the sebaceous filaments are going to just reappear. Now, in some people, again, in the oily skin, these sebaceous filaments are quite troublesome because they just appear larger. Okay, so the only way of really treating those is with your home care, which we'll discuss in a minute. Another reason for the open pore then is scarring associated with the acne-prone skin. So when we have pores or follicles that are filling up with oil, filling up with dead skin, they're going to become stretched. Particularly then if they have the acne infection in them caused by the acne bacteria, you're going to get papules, pustules, the inflamed spots that we all know in the acneic skin. And with repeated infections in that same follicle, we're going to get scarring or micro scarring in there, which is going to make the pore then look more open anyway. So even when somebody's had acne years previously and they've managed to eradicate it, they may still have what they think looks like open pores, and is actually what we call ice pick scarring. So I'm going to show a picture of ice pick scarring now. And that is distinguished from the open pore because it looks slightly less regular. Rather than being just a round pore, it can look almost like a little cave in the skin. And depending on how bad the initial infection was, you can actually see they can sometimes appear deeper, or you may have some that are bigger than others. So that's what we call ice pick scarring, not to be confused with your standard open pores then. Last but not least then, a very important one. So some people may find as they reach maybe 40s, 50s, 60s that their open pores appear worse, but their oil production's actually decreased. So what's going on there is that as we age, we naturally lose collagen from the skin. So if you imagine you have a nice round pore on your face, and then surrounding that then is your skin surface. If your skin is losing collagen, it's becoming more lax. So what's going to happen is, surrounding that pore, everything's just becoming more lax and the pore appears then bigger. So decrease in collagen is a contributing factor to open pores in your more aging skins. So how do we decrease this aging process? Well, we can't decrease somebody's genetic aging and the general passing of time, but it's 80% of the damage and the collagen loss that we see on somebody's skin is actually due to sun damage and free radical damage. So things like UVA exposure and smoking. So decreasing smoking is going to help with open pores, believe it or not. And also using your broad spectrum SPF, so something that contains physical and chemical ingredients, to protect you from those UVA rays that are there all the year round, and they're also there indoors. So sunscreen needs to be worn every single day. I often get asked what sunscreens I recommend. And I would always recommend something that contains a physical ingredient. So things like zinc oxide, titanium dioxide that are physically going to reflect those rays off the skin, and therefore then the skin isn't participating in any kind of chemical reaction whilst it's protecting itself. You do have sunscreens that contain chemical filters also, so things like octocrylene. These actually warm up the skin whilst they work. So they convert the UVA ray into heat, protecting the skin that way. Personally, I don't like these ingredients as much as the physical sunscreens, and I think any skin specialist would agree with me, because they do have this damaging warming effect on the skin. However, if it is all you can afford, or it's all you can get your hands on, by all means still use it, because it's far better for the skin to be protected from UV than to have no protection whatsoever. Okay, but a skincare specialist can advise you on perhaps a sunscreen that contains a good mix of physical and chemical ingredients. You can achieve a nice high factor rating without damaging the skin. So SPF is your friend when we're talking about any skin concern, not just anti-aging. If you suffer with acne, then a sunscreen is going to also be your friend, because you want to try and keep your good bacteria alive. UV light will actually kill some of the good bacteria that are on the surface of the skin. So sunscreen is absolutely essential when we're talking about treating open pores or any skin complaint. If you are suffering with an increase in oil production, or you're a skin specialist watching this and you want to try and decrease a client's oil production, it's quite difficult, because most of the time it is due to hormonal influences or genetics. So there are ingredients that can clean out the pore, so things like alpha hydroxy acids and beta hydroxy acids are actually better. So things like salicylic acid will actually go in and clean out the pore. We've also got azelaic acid, which is quite good for acne, and azelaic acid can actually have an influence on oil production as well. Ingredients like octadecanodoic acid and sphingosine can actually help with oil production levels. Skin peels and retinol-based ingredients. So we have retinol ingredients as well, which can actually break up the dead skin that might be clogging the follicle. So if a client suffers with that, then retinol can actually help with this as well. Retinol and BHA, if you're using them, it's sometimes better to be using them at night, because obviously they are photosensitizing ingredients and they can cause more harm than good if they are overused or used and then the client goes straight out in the sun with no sun protection. So really mindful that if you are using active ingredients like retinoids and acids, that we are really seeking the advice of a skincare pro, because it might be that you need to go from a low strength to a high strength, and it's therefore going to take longer to see a result. And also your skincare pro can advise you on what sunscreens they would recommend to go in conjunction with, and also, what order to be applying these products in, for example. Skin peels actually contain higher levels of either acids or retinoids, or sometimes both. Again, make sure you go into somebody who's qualified and knows what they're talking about when they're peeling the skin. They're just going to give you an increased result on what you'll see at home in terms of reducing oil production. They're also going to really exfoliate the skin. So if you've got a buildup of dead skin in there, we're going to help to decrease that. So that's going to reduce the appearance of the open pore in that way. Also, somebody who suffers with the aging side of things, so maybe they're needing a boost in collagen production, a skin peel will do that for you. But again, it's important to seek the advice of a skincare professional, because what acid is used in an oily skin versus an aging skin might very well be different. Collagen production and also acne scarring. Derma rollering or microneedling is very, very good for this. I've got the Nimu derma roller here, which is a 1 ml roller, which is enough to stimulate collagen production. So 4 to 6 weeks after you almost prick the skin with the needle, injure the skin in a way where it's going to produce more collagen to try to heal itself. So 4 to 6 weeks after treatment, the collagen is going to be knitted back together in a much more regular pattern. So it's quite good for acne scarring, particularly box scarring, like the deep pitch you'll see on the acne skin. Not so much with the ice pick scarring though. So in my own personal practice, I find that around 50% success rate with ice pick scarring. I think what's happening when we're trying to treat ice pick scarring or open pores with the roller is actually the collagen production is plumping out the skin to the point where the pore doesn't appear as large. If you're trying to decrease micro scarring within a pore, like ice pick scarring, it's much, much more difficult. And sometimes, a dermatologist, experts, things like you can actually almost skin graft into the ice pick scar to decrease the appearance of them in that way. Also things like IPL and laser. So if you have a laser technician near you who's got good track record of treating this, you can actually decrease sebaceous gland production with some types of laser because they'll almost kill off the sebaceous gland, and also like resurfacing laser, so which will work in a very similar way to a skin peel then, as in taking away the top layer to encourage regeneration. So in summary then, if we have a client who is suffering with an excess of oil, we would treat with home care and also skin peels. Also, you can use the microcurrent device. This one here is by Biotherapeutic. It's an in-salon treatment that literally vibrates the skin on a spatula, and then the contents of the pore are literally emptied onto the spatula. It's quite lovely to see as a skincare specialist, but it does need to be repeated every month or so, because ultimately if the client's not using home care, that backlog of oil and dead skin is just going to keep occurring. If you have somebody who's decreasing in collagen, then skin peels are going to help, derma rollering is going to help with that, perhaps laser resurfacing, radiofrequency treatments in salon, and LED light therapy can also increase your collagen production, as can cosmeceutical home care, particularly with a brand like Nimu that contains your retinols and your AHAs is going to help to increase collagen production. But ultimately, SPF is your friend. So you do need to be wearing your broad spectrum SPF every single day, even in winter, to keep the collagen that you already have and prevent further damage. Microneedling is good for the aging skin and also for the acne skin and also for acne scarring. Derma rollering can treat a multitude of concerns. However, if it is associated with an acne infection, I'd like to get the client on home care as well to decrease the inflammation and the bacteria in the skin before we go ahead and go and treat any scarring. And also, if we're talking about the ice pick scarring that we discussed earlier, which is the scarring inside the pore that makes it appear more open, it's almost like tossing a coin as to whether you're going to get a result with microneedling. So by all means try it, it would certainly be safe, but it may be that you have to seek the advice of a dermatologist if the acne scarring is particularly extensive. So I hope that has discussed some of the options available to you if you do suffer with open pores, or if you're a therapist watching this who's struggling to treat them. Identify the cause first and then treat that cause. Maybe that you need to treat in multiple ways, but definitely sunscreen and definitely home care ingredients. Thank you very much for joining me. If you'd like to book yourself a free skin consultation, these can be done online or in my clinic, which is in Bridgend in South Wales. You can book via my website, which is hannahmcandrew.com. If you are further afield and you would like me to put you in touch with a therapist who's qualified in the methods that we've talked about today, then just send me an email, info@hannahmcandrew.com, and we can find you somebody who is more local to you. Thank you very much for joining me, and I hope to see you on another video again soon.